mention all of the people who are here today because I know I'm going to forget someone, but just off the top of my head, I see Bob Baxter, the head of the Mercy system in town, and Randy Oster, the head of the ProMedica system, Pete Gherkin with the county commissioners. I shouldn't have started doing this. Chief Bird from our fire department. You're going to hear about the movement in a moment and what that is and how they're going to help. We're going to hear from Sean Savage and the VProject, and I think we have some news that is important. It's an important step in our journey of beating the vaccine. Now, there are some of us, like me, if you notice this little pin, with the VProject pin, who have been fully vaccinated now, and that's great. When you look at our percentages, in terms of adults who have gotten at least one shot in the arm, we're at about 50%. Might be a little higher, a little lower, but it's close to 50%. And by the way, Lucas County, Eric from Lucas County and Ben from the Wood County Health Department have done a great job. And really, in a lot of ways, we're leading the state in terms of our percentages and in terms of the creative things we're doing to get people vaccinated. Up until today, up until about this moment, the goal has essentially been getting people to the vaccine. We're beginning to transition now and looking for creative ways to get the vaccine to the people. All along, we sort of anticipated that once we got to about 50%, which is where we are right now, that it was going to get a little harder. That the people who were anxious to get their shot, the people who were most enthusiastic about getting vaccinated would have gotten it and would have comprised that 50% or so percentage that we have. And that's what's happened. But now we're to the point where demand is starting to wane a little bit. Yes, there are people who just ideologically don't believe in the vaccine and are never going to get it, I suppose. But there's also an untold number of people in our community who aren't opposed to it, but it hasn't been easy for them to get it. Maybe getting in the car and driving out to the rec center isn't the easiest thing or a top priority given the needs in their lives. Maybe they're homebound. There could be any one of a number of barriers that have made it difficult for them to get the vaccine. And so as we push toward the final 20-25% that we need in order to reach herd immunity, we know that we have to adjust our approach to begin finding ways to bring the vaccine to the neighborhoods and to help look for other ways to get people engaged and vaccinated. So what we are beginning this week is a move to canvass the neighborhoods of our community, beginning with the zip codes where vaccination has been at the lowest, and to try to truly, in a door-to-door grassroots sort of way, get people focused on the thing they need to do to get back to what we all want to do, and that's live our lives, free of restrictions. So we're in the 43607 zip code because, according to our numbers, that is for whatever reason, that zip code has the lowest percentage of vaccination right now. So we're going to start in 43607, and we're going to progress through zip codes in sort of a reverse order, addressing first those zip codes with the lowest participation. The movement, who we're going to hear from, is part of our partners that is used to grassroots activism and it's used to hitting the streets and working at the door-to-door level. They're going to be a part of it. But before I turn the mic over, one other service that we're offering as we begin to canvass it is still over my shoulder. You'll notice a fire. What would you call that? A life squad, ambulance? A medical unit. Medic unit? Yes. All right, that's a technical phrase. As Chief Bird just pointed out, you'll see that we have a Toledo fire vehicle that is going to, that will have vaccines in it, and that will sort of slowly make its way through these target neighborhoods in rough coordination with the volunteers who are going to start canvassing. Now, we've been, as we've planned this logistically, obviously we didn't want to take firefighters out of, off the line, as it were. We don't want to take anyone out of service. So we are coordinating units like this to make sure that we are still able to fight fires and provide emergency care as we need it. So this, the fire vehicles that you will see as part of this project, it's not going to be a 24-hour day, 7-day-a-week sort of operation, but several times a week, coordinating with our canvassing efforts, you will see a friendly red Toledo fire vehicle following these volunteers. And so the notion is, if there's someone who, is not against getting the vaccine, but just hadn't, for whatever reason, didn't have the time or the energy or whatever to, get in a car and drive, 20 minutes out to the rec center, that equation might be a little different if they say, well, geez, it is idling in my driveway right now. I suppose maybe I'll just run out and get that shot right now. So that's what we're trying to do. We're looking for creative ways to increase the numbers because if we want to get back to the life that we all want, we need this final 20-25% to become vaccinated. So today is just another, it's the evolution of what the VProject is all about. And I personally want to thank everyone who is here, and I'm hoping I didn't miss anyone who wasn't going to speak at any rate, but very thankful for all of the partners and the grassroots effort that's going to continue this effort. And when I think of the VProject and think of all the work that's been involved with it, the name that comes first to mind for me is Sean Savage. I don't know if he has a title, president, potentate, grand executive of the VProject, but the VProject has been his passion and his brainchild, and I'm going to bring him to the microphone next for him to give comments as we move forward. So, Sean.
Oh, thank you, Mayor. Appreciate it. And thanks, everybody, for being here. I'm excited because the VProject, which, as you can see behind me, it stands for Victory Over COVID-19 Through Vaccination. We have hundreds of community members, community leaders that are involved in this project. And what's exciting to me is to a T, every person that I asked to get involved in this project said yes. And that speaks a lot to what Toledo, Northwest Ohio is all about. And as the mayor mentioned, this is a pivot point for what we're doing. So we have a four-part strategy that we're announcing today that's beginning today. And the first on there is the call center that's starting tomorrow night. There'll be tens of thousands of calls, outbound calls made to the community, to members in the next 8 to 12 weeks. And the focus of those will be to see if people have questions regarding the vaccine, and then also to help people get scheduled for the vaccination. So that call center launches tomorrow night. The canvassing effort, led by the movement and Tina Butts and her group, we're excited. They have a proven track record. They know what they're doing. And they're going to start right in this zip code, door to door, as the mayor mentioned. And once again, that's going to be about a 12-week process to make it as easy as possible, remove every possible barrier that there can be to getting vaccinated. And that's key for the community that we're serving. The employer pods. So we have a lot of employers having providers come into their places of employment. We encourage employers to explore this option. Even if you think you have half your folks that have been vaccinated, you're probably right. But there's another half that just need a little more convenience. They need it to be a little easier. So please communicate. You can communicate with us through vproject.org, and we'll help you get a provider locked in to come into your place of employment and help vaccinate the remaining of your employees who need it. And then the last is a marketing and communication surge that you're going to see. And there's going to be quite a bit of messaging that's going to start here over the next couple of weeks, led by Steve Hansen's team. And we're very excited about what that's going to do. The last thing I'll mention is we have V Week that's coming up May 10th through May 16th. That's going to be a community-wide vaccination focus for that week. And there'll be much more to come regarding that. So with that, I'm gonna turn it over to who I consider an absolute community visionary, and that's Mr. Randy Ostra, CEO of ProMedica. Thank you.
Good. Thanks, son. Great, thanks. Good morning.
Good morning.
So first off, let me add our thanks to Sean's leadership. I know he's got a full-time job, but I think this is his second full-time job. You know, the mayor talked about it. This is a really important time as we think about COVID, and we see a little uptick in numbers again. And really, you know, one of the things we've learned over the last year, it's probably for folks who work in healthcare, probably the most humbling year when you see everything that's happened. Of course, it starts with the impact of COVID on people and families, loss of lives. You know, just how communities have come together. Healthcare workers who are special people, but you know, day in, day out, taking care of people with COVID in very desperate situations. Our first responders, all the work the community has done to kind of rally together. But I think, as the mayor said, now is a really pivotal time, and this comes back to a theme we talk about a lot, and it's the work that we do in neighborhoods and with our neighbors. When you begin to look at what we learned from COVID, one of the shocking things, I think, to a lot of people was how it impacted the minority community and those that live in poverty, below the federal poverty line. We have almost 50 million Americans who live below the federal poverty line. And the challenges that they have each and every day, whether it's housing or opportunities or access to health, and then when you begin to think about those challenges and how they've been disproportionately affected, you know, it's critical. We're at a very, very critical time where we need to get to neighborhoods. We need to get to neighbors. You know, the way you put COVID behind us is the things we're doing, the precautions, getting people vaccinated. So that's why this work is so critical. That's why having you here and carry this message is critical. Because again, it's people looking out for neighbors. It's us looking out for people who are in neighborhoods have specific challenges, and really that's the way we're going to address it. Greg Braylock from ProMedica has been the co-chair of the Minority Health Committee. I'm going to ask Greg to say a few words. So thanks for being here today.
So again, my name is Greg Braylock Jr. I serve as our co-chair for the Minority Health Committee within the VProject, along with Donnie Miller, the president and CEO of Neighborhood Health Association. You know, I'm probably one of a few hundred people and a number of people that are standing around the podium today that are really putting a lot of effort into making sure that everybody in our community has access to the vaccine. We know a lot of the trends, the stats, the numbers, the figures around our Black and Latino Americans and citizens in Lucas County in terms of vaccination rates, the impact of COVID. You know, we're 2 to 3 times more likely to be hospitalized and to die from COVID. That has a number of factors based on density of population, the kind of frontline service work that people do, as well as underlying health conditions. Our point is that we want to make sure we get people accurate information and that we make vaccination really easy for people, convenient and flexible. And so many of the points that you see here on the board are what we're using to target some of the zip codes that were mentioned, you know, 07 for sure, 05, 04, 08, 09, 10, 20, a number that are hovering around 20% below or a little bit above vaccination rates. You know, our message is not that we're here to force people to get vaccinated, but we want to, again, make sure that when people have the information that leads them to a decision to be vaccinated, that they have the opportunity to get vaccinated really quickly and in a really efficient way. And so as we think about the strategy to make sure we begin to engage people more aggressively in vaccination, and how we mobilize volunteers as well as staff to help get into neighborhoods, really feet on the street to make sure that people have information, are becoming vaccinated is really key. And so working with the movement, who you'll hear from Tina Butts in a second, as well as other organizations, you know, across the city, the county, as well as a number of different nonprofit and community organizations that are doing work across the city in different zip codes, different parts of town, is really, really important. And so this is a coordinated effort, one that everybody is going all in on, and we expect to see much more improved results as we move forward because of it. Tina?
You know, listen, my name is Tina Butts. I am one of the movements. I don't want to have a title on it because first and foremost, we are a team in this community. You know, we get out here, we fight. But what I want to do is I want to talk to the listeners out here. I want to talk to them from our heart and head because each and every one of us have been affected by the COVID. Rather, our family members have died in the hospital now that's out here fighting for their lives. You know, our team decided to come together. We're partnering up with the VProject. We're partnering up with our friend P. Gherkin in the city of Toledo. We are going to get out here. We're going to turn over every brick, every rock. We're going to be at every corner store. We're going to be up and down through these neighborhoods. We're going to have all the boots to the ground. I want to encourage you that's at home. You know, the grandparents are sitting around. You might feel that you are protected because you're young. But when you are, you could be, you could be a carrier. And you could be the one responsible for hurting your grandparents that's sitting at home, or these young babies out here. They going in the hospital today, every single day. And I know that the message, a lot of us don't sit at home, watch TV, read papers in the news. So our goal is to get out here, knock on these doors, get our numbers up, because we fighting an invisible ghost, okay? So our team have partnered up with the city of Toledo. Our friend, my brother, Mr. P. Gherkin. I mean, every time we call the phone, he's always there to answer to the call. Sean with the VProject, great. And I couldn't think better. And then we got a dear friend, Matt Sapiro, over there at Mercy St. Vincent. So we're going to get out here. You will see us out here. We're going to have signs at every corner store. We're going to be out here in the community. And we're not going to stop till we help save more lives, my friend.
Thank you. I want everybody today to walk away from this press conference remembering at least one thing: Tina Butts and the movements. Introduce them to the community. Look, we're in a war with COVID. We're in a war with the virus who we know the name of. And it's always great to have the generals, the lieutenants, and people that bring resources to that war, to it. But you don't win any war without ground troops. And where the beauty of what we've done in Lucas County and the city of Toledo is the coordination of the business community that Sean Savage brought to the VProject, the institutional power that both Mercy and ProMedica have brought to this, the medical prowess that they've had, the leadership of Eric and the health department, the leadership of the mayor and the board of county commissioners is great. But we're not the ones out there going to deliver this message in the communities that don't know us the way they know Tina and the movements. So we started to think about what's the tactic to get to the street corners, to get where people are. My first thought was get somebody that knows how to do it. Some of us that are politicians in the room, we know about ground campaigns. We have to do it in our own elections. We know about door to door. This is no different. Get the people who know people. Get the people who can deliver the message with the right competency. Get people that they trust in these neighborhoods, and if you do that, we're gonna be successful in these under-resourced neighborhoods. I'll say right now, I would guess that Tina and the VProject and everybody out here, especially with Tina's help, we've probably put 8,000 to 10,000 shots in arms because of these people in partnership with all of us together. That's unprecedented, and I'm not sure there's any other community in Ohio that's doing what we're doing. The corporate community, the institutional community, the government community, the private sector, and people on the streets. We're going to win the war in COVID because we have generals, we have lieutenants, and we have the best ground troops in the state of Ohio. Sheena, wait. I'm going to do this. Sheena Barnes is a school board member here, and I know, Mayor, you missed somebody, but thank you. She's the kind of school board member, she's out there every day on the corners with these people doing the work. So thank you, Sheena.
Well, thank you, Commissioner, and I also want to echo the words that have been said before. I want to thank Sean for his leadership in organizing the VProject. It really is an incredible pleasure to be standing up here today with all these community members who are dedicated to the fight against COVID-19. And I think with that in mind, this event really is further evidence of the coordination and the collaboration that's taken place amongst all these organizations between Lucas and Wood County to really fight the vaccine and to make the vaccinations as accessible as possible. Mercy Health, like our partner standing with us, believes that getting the vaccine shouldn't be hindered and that anyone and everyone who wants it should have easy access. In fact, it really is incumbent upon us to make access to that vaccine as easy as possible. We've said it before, and I truly believe that we want to be the easy button for vaccination, and I want to thank everyone, especially those members of the Mercy Health team who have worked tirelessly over the last few months to get shots in shoulders. One way of doing this right here is to go to where people live and work. So to date, Mercy Health has vaccinated or administered about 115,000 doses in the region. Part of that is by partnering with school districts, unions, organizations, and area businesses. Our teams have created opportunities to administer vaccines to all eligible recipients in a location where they feel comfortable and it's convenient. Mercy is grateful to all the organizations that that have referred to us and the confidence you have in our team. Initially, we provided closed pods, or I'll also call them employer-based clinics, simply to make it easier on our community. But there were some unintended and surprising consequences to this as well. In our employer pods, for example, data showed that the African American population was representing about 20% of the vaccinations that we administered in our employer pods. That would compare to about a 5% rate in the open pods in the mass vaccination sites. So that was a pleasant surprise for us as we looked at vaccine equity. Also, we noted that the no-show rate in the employer-based clinics was significantly lower than the open pods. So another evidence of really seeing access being easier when we can take the vaccine to where people are working. So by partnering with schools, we were able to vaccinate more than 1,500 students and their family members in both Lucas and Wood counties. So as you can see, this type of vaccine clinic has proven successful throughout our community and is an important aspect and part of the tool set to improve vaccination in the area. So together, through these collaborative efforts, we can reach more people who need help. Again, I stand here proud to be part of a community that cares so much about its residents, and I pledge that Mercy Health will continue to do everything we can in this important work. So it gives me great pleasure to introduce a great community organizer, Juanita Green, and welcome her to the podium. Thank you.
That's my baby.
Thank you, and thank you so much, Mr. Baxter. We appreciate all the work that Mercy has done. My name's Juanita Green, and I'm retired and love this community and have worked in this community, and I'm also the administrator of First Church of God. When we heard about the VProject, which is a project that is bringing us all together in all facets of life, it's also a project that helps us to understand that our neighbors and our friends out there, some of them that are underserved, need our help. And by coming together as we've done, that aided us through our church to come together as a nonprofit and say, what can we do? So after speaking with Bishop Culp and also the volunteers at our congregational family, we said, let's get in the fight, because this is a fight. It's something that we all are going to be adhered to. It affects all of our families. It affects our elders especially. The community is the one that basically said, I need help. We basically sent out our emails, our texts, we went to our neighbors, our mothers, our fathers, and said, what can we do to help? So we opened up the facility. And when we opened up the facility, the community said, how can you help me with the barriers that I'm against? The barriers of transportation, the barriers of technology, and the barriers of education. And that's what we are all about, all of us in this community. We're here to help our brothers and our sisters. We're here to aid a helping hand. And that's what we were able to do at the site at First Church of God. And we are still continuing to do that through the phone calls that are coming in, to people saying thank you, to people walking over to the church and saying, this is a trusted site. So I would like to encourage any nonprofit, any church, any organization, if you have the opportunity to open your doors, please do so. We will come out and organize and help you get organized. But make sure that you understand the community needs your help. It doesn't matter what zip code you're in. The services are here to help you. We have great partners. I must recognize ProMedica. ProMedica was our doctors, the nurses, the healthcare leaders that worked at our site. The customer service was phenomenal. And that's the key to a site. What customer service you give, how you answer the phone, how you make people feel welcome. And that's what's important, because people don't understand. They just feel as though they've been living in a disarray for a whole year. What can I do to be helped? The most important thing is call them back. Let them know you are important. And that's what's important about when we book them, we register them, we let them know you come to this site and you will be serviced. And I know that's what the movement's been doing. So welcoming and making sure that our community knows that we're going to win this fight with the canvassing, with the outbound calling center that's going to open up on this coming Thursday, the 22nd. We're going to be calling you, and we're going to be letting you know we're here to help you, and you don't need to be afraid to come out and get the vaccine. What we need to understand is that we're suffering, and we need to make sure that the suffering ends and where life begins. Thank you so much, and we appreciate all that everyone is doing, and I'd like to bring Mr. Sean Savage to the podium.
Thank you, Juanita. What a champion. Just one final point I'm going to make. When vaccines started to be administered in the United States, there was over 3,000 people a day, 3,000 plus per day dying from COVID. Today, it's under 1,000 per day in the United States. And there's one variable, that's the vaccine. So it's indisputable evidence that vaccination rates, as they go up, the number of lives saved goes up. The number of people dying is going down dramatically. So please do everything you can as a community. Let's come together and let's get this done over the next 8 to 12 weeks. Thank you very much.